Hi, this is Dr. Vivek Shrivastava. I am here today to discuss about physiotherapy equipment, that is ultrasound. Indeed, that is the most used physiotherapy equipment worldwide. Ultrasound has two frequencies which we use for therapeutic effect, that is, one is 1 megahertz and the other is 3 megahertz. Apart of these frequencies, there are some other factors also which you should know. So we will have a close look about this equipment. This is a combination machine from Striker Brio, and this has three modes of frequency. One is 1 megahertz, 3 megahertz and a dynamic one. Apart of this, we have burst frequency 16 hertz, 48 hertz and 100 hertz. The duty cycle is like pulse mode or continuous mode, that is 10%, 20%, 50% or continuous. Apart of this, we can use with other electrical modalities also, like TENS or IFT we can use in the same time. When you want to set this machine, what you have to do, you need to choose a frequency, then duty cycle whatever you want. I will put it on continuous mode. Then the burst frequency 16 hertz, then I'll choose the time, whatever time you need you can select that. Then power, whatever intensity. The therapeutic effect starts from 0.8 to 1.2 for acute conditions, 1.2 to 1.5 somewhere we use for chronic subacute conditions, and for chronic I normally prefer to go for 2 watt per centimeter square. That is something like it depends on area, what area we are treating, the size of head and the duration also. When you start this machine, you can play from here, and very important thing about this machine is it will not start until unless you apply the gel or it is in contact with the skin. One more thing what you should consider about your treatment, how much pressure you should apply while giving ultrasound. I suggest when you want to give ultrasound therapy, you should apply just a pressure which is sufficient enough to move your skin along with the head. It should not be too light or it should not be too much pressure. So the pressure should be gentle and the underneath skin should move along the head. That is the optimal pressure we should use while performing ultrasound therapy. When you want to check your ultrasound whether it is working or not, there might be some problem. There can be loose connection between your wires, or there can be some fault in the machine. So if you want to check your ultrasound, what you should do, you should apply some water over the head like this. Turn your machine on and increase the intensity. As you can see here, these little bubbles are because of the ultrasonic waves. So this is on 3 megahertz. If you check it for 1 megahertz, that will look like this is on 1 megahertz. So we can see the difference in these two frequencies. Thank you.